What is cellular therapy? Is this currently being used to treat AML?
So cellular therapy has really revolutionized the treatment of a lot of different hematologic malignancies such as lymphoma, multiple myeloma, ALL. But in AML, it has not been effective to date. And a lot of this has to do with the fact that cellular therapies really need a target to go after. You really need something for this cellular therapy product to target and clear away the disease. And in AML, because these cells come from a very early form of a stem cell in the bone marrow, it is very difficult to find targets that can say this is a leukemia cell and this is a normal cell. And so there is advances that are being made into identify these different targets of leukemia cells that can be exploited to target with different cellular therapy products. But to date, it hasn't been as encouraging as it has been in other diseases where there are more established targets to differentiate cancer versus not cancer.
Cellular therapy, in some ways, again, the bone marrow transplants, as I mentioned before, is a form of cellular therapy, and fundamentally these are, bone marrow cells, stem cells from a donor that are being used to hopefully kill off the bad leukemia cells once they make a new immune system. So that's really, in some ways, bone marrow transplantation is a form of cellular therapy. There are other forms of cellular therapy, and I think people often ask about things like CAR T cells. So CAR T cells stands for chimeric antigen receptor, CAR. T cells are a type of immune cell. So that is also a form of cellular therapy, and that's a form of cell therapy that has been best studied and is approved not in acute myeloid leukemia, but in a different acute leukemia called acute lymphoblastic leukemia, or ALL. It's not an AML, but an ALL. And in those ALL patients, CAR T cell therapy has proven to be, remarkably effective in certain settings, and even in settings where other therapies might not have been, effective. And there are some risks to that, as well, which we could talk about. But one of the keys for an effective CAR T cell therapy is having the right target. So fundamentally, what CAR T cell therapy is, ideally you take a patient's cells, take them back to the laboratory, and you actually genetically modify those cells so that they can see and attack the patient's cancer cells. But you have to basically build in what is the target that you want these cells to find and kill off. So in acute lymphoblastic leukemia, it turns out that there is a cell surface protein that's a really good target for the CAR T cells. So CD19 is on the surface of all these B cells, and so it basically enables these immune cells to recognize CD19 and attack and kill off, all the cells that it finds that has that protein. So in ALL, that works really, really pretty well. And you can get rid of all these, B cell-like cells, for example, and you can live without those cells. You can get infusions of antibodies as needed. That's kind of what those cells would normally do. In AML, it's tougher because AML, acute myeloid leukemia, those cancer cells look a lot like the other normal bone marrow cells. They share a lot of the same cell surface proteins. So that can be very challenging because when you design a therapy, what's the target then? So if you design it against something like CD34 or CD33, these are just proteins on the surface of these cells, you might wipe out the bad leukemia, but then you're also really maybe wiping out a lot of the good cells as well, and maybe having other sort of side effects. So it's tough. So CAR T cell therapy right now, and as a form of cellular therapy, is very much investigational in acute myeloid leukemia. But there are some clinical trials that are ongoing. Here at Sloan Kettering, we're about to roll out one of our first, CAR T cell trial for acute myeloid leukemia, which we're really excited about, targeting a cell surface protein called CLL1. And then there's also some other interleukin, some other ways of basically modifying that cell to make it really try to kill off the bad leukemia cells. But right now it's at a very early stage, I would say.